With 1.6 million cases, Europe has become the region in the world with the highest number of people with COVID-19, surpassing Latin America and the Caribbean. It has become the new epicenter of this global pandemic, as it did back in March and April. Now, back in March and April, France, but also other European countries, were facing a shortage of face masks, but also of diagnostic tests. And we were told back then that those were the two key elements to stop a global pandemic. But today, we actually do have face masks. We have diagnostic tests. We know how to better protect vulnerable people and better treat people who develop a severe case of COVID-19 with cortisone and with oxygen. But yet, the number of people who still go into intensive care units in France today is still going up. And the number of hospitalization is close to the peak that we experienced back in March and April. The R naught is also going down closer to 1. It's around 1.4 in the Parisian region, 1.8 elsewhere in France, but it's still under what we knew back in March and April. The R naught was 2.7. And although we know that all of this data needs to be looked at in a holistic manner, that the figures all have flaws, it does bear the question of why is the second epidemic wave so violent and also so unresponsive to all of the measures that have been put in place. We will know with time which measures were important, which weren't. Contact tracing may appear as a key element, but what's for sure is that as of now, the virus behavior is still very erratic and scientists still have much to learn.